Hi, everybody. We will get started shortly. Emily is going to be the moderator. I'm just looking to admit everybody and get us all set up. We'll start right at 2 o'clock.
All right, good afternoon, everyone. It's 2 o'clock, and so we'll get started today. So welcome to our COVID-19 learning series for long-term care. My name's Emily, and I'm a program manager in the long-term care program. And I'll be the moderator for this series. I want to remind you that the session is being recorded and that all participants have been muted for the session. To start off today, I want to acknowledge that I'm a visitor working on the traditional territory of the Lekwungen-speaking people, known as the Saanich, Songhees, and Esquimalt people. You may be joining me from across the health authority, so please take a moment to reflect and think about the land that you're joining us from. So thank you again for taking the time to join this learning series, whether you're joining live or listening to the event afterwards. The purpose of the series is to build your confidence and help you feel better prepared to work safely during an outbreak. I want to start by recognizing all of the hard work that everybody is doing every day at work and at home by taking the time, following Dr. Bonnie Henry's guidance to be keeping with our Safe 6, being diligent with our hand hygiene, being diligent about wearing a mask. All of this is so important. And as leaders working in healthcare, it's really important that we're demonstrating how we're maintaining these safety practices. We all know it's truly our best defense in how to maintain or how to keep COVID out of our long-term care homes. So today is the first session in our 5-week learning series, We're starting off by talking about influenza in the COVID era. The presentation has two parts. We'll start with a presentation by Julie Marriott. I'll turn it over to her in just a second. We'll also have a panel discussion afterwards, and I'll introduce the panelists later. If you have questions during the session, we won't be taking live questions via Zoom, but we do have a Slido page set up. So if today's session causes some questions for you, or if you'd like to ask some questions, go onto Slido, which is sli.do, and look us up under event code influenza season. You can type your questions in there, and if time permits, we'll take live questions after the presentations. So I'll turn it over to Julie, and I'll just give her a quick introduction. Julie Marriott has been a nurse with Island Health since 1996, and she currently works as an infection control practitioner at the Royal Jubilee Hospital and also at the Summit Long-Term Care Home. Julie has spent many years working as a communicable disease nurse, and she's happy to share highlights from the annual influenza education developed by the Regional Infection Prevention and Control Team. So Julie, I will turn it over to you.
Thanks, Emily. I'm just going to share my screen here. There. Can everybody see my screen? No?
No, it's not coming through yet, Julie.
Okay. Still nothing?
No. Let me try to do it from my side, Julie.
Okay.
We'll see if we practiced this. It went perfect in rehearsal.
Sorry.
Is that working now?
Yes.
Okay. So Julie, I'll advance the slides for you.
Okay. Sounds good. Do you want to put it on the slideshow type?
And oh, this is what we get for being the first of the series. I'm just going to do that again. Bear with us 1 second, folks. Okay, that should be going now.
Perfect.
Yeah, Bevan, give me a thumbs up if we're doing this right. Excellent. Okay, thank you. Go ahead, Julie.
Okay, can you go back to the very first slide? There we go. So welcome to seasonal influenza. Next slide. It's just really important to remember that flu is around, but it is something that can be very dangerous, as everyone who works in long-term care does know. Next slide. So our learning objectives today is twofold. We want to talk about an outbreak and prepare sort of the unit, the facility, the frontline worker for your roles in an outbreak, and also what the CD team and the IPAC team does. The other important thing will be we want to give you some practical tips about what you can do right now to make a difference in your facility before flu season starts. Next slide. So seasonal flu. We all are pretty familiar with seasonal flu. It's a highly contagious respiratory infection. These strains change year to year, hence our need for a flu shot every year. And you know how dangerous it can be for our residents in long-term care. Next slide. This is some Canadian data, really just highlighting that flu season is typically between November and April. It tends to peak around mid-December, but having watched influenza tracking over the many years, I have found that our flu season now tends to peak last week of December, first week of January. It's where we tend to see most of our cases here in BC, or on the island anyway. So far, we've had 2 positive flu swabs back. Both have been in kids, so we aren't having flu circulating around the community yet, but it will be coming.
Oh, Julie.
Yep.
I was just going to say, we've not actually had any actual flu. They've all been vaccine related thus far.
Oh, perfect. There we go. Not even real flu. Thank you, Dee. Next slide. So this shouldn't be new to anybody. The signs and symptoms of influenza are very like the signs and symptoms of COVID. The important thing to remember is that we will be following COVID protocols until COVID is ruled out. And we will deal with the influenza outbreak once we know that it is not COVID. So next slide, please. So we've got some really pillars of prevention that you should all be familiar with. Immunization, good hand hygiene, and respiratory etiquette. These are basic, simple things that everybody should know all the time that will prevent an influenza outbreak. Next slide. So I want to talk a little bit about 3 things here. We're going to do some talking about prepare for the flu season, what it looks like when we declare an outbreak and confirm an outbreak, and then what it looks like when we declare the outbreak over. So next slide. So in preparation, next slide. Island Health has developed this really great seasonal checklist, which is available both on the intranet and the intranet. If you haven't seen it already, you should definitely check it out. It will just walk you through step by step what you need to do now to prepare for an influenza outbreak, including immunizations, getting creatinine clearances for those residents who need it in preparation for Tamiflu, etc. So have a look for that if you haven't seen it already. Next slide. So here's the practical part. I want to talk about decluttering. This is really important information that often, you know, we will walk past a cluttered corner, especially in our houses, you know, all week and not even see that it's there anymore. But clutter will really, if we can get rid of the clutter, it really can help with the housekeeping, and clutter can be a potential transmission for pathogens. So next slide. We're going to focus, we've got 5 areas where I want to talk about where you can go right out to your residents now and have a look at these places and try and look at it with a critical eye. So you're sort of stepping back and seeing the space and looking at the clutter and thinking, what can I do to make this better? So next slide. Common areas. So have a look down your hallways. It's really best if you can keep your hallways clear, but if you have stuff in your hallways, try to keep them to one side. If you have garbage cans in your hallways because you have a resident who's on precautions, try and keep that garbage can within the resident's room so that not everybody who's walking down the hall goes past that garbage can and can potentially become contaminated. Garbage cans should have lids on them as well. The other really important thing about common areas is horizontal surfaces, which are very easy. You're going to hear this over and over again. Keep horizontal surfaces clean so that they can be easily cleaned during the day. Next slide. So when it comes to linen and linen carts, you really want to make sure that your staff has a linen bag at the point of care. So like a soiled linen bag where they're not putting the soiled linen, on the bed or on the floor, in a sink, wherever. The other really important point to make to staff is really try not to overfill those bags. It just will make it much easier on the staff if they just keep them 2/3 full. If you are in a situation where you are using linen carts, you really have to be considerate of how you're using them. So bring them out of the hallway with the clean linen into the room that you are getting the linen for, and only stock them for what you need. Once you've done your AM and PM care, then whatever's left on that cart should be laundered, and that cart needs to have a process where it is wiped down. Next slide. So residence rooms can really get out of hand, especially when you have multi-bedrooms, and multi-bedrooms with one bathroom, of course. So personal hygiene items should not be stored in the bathroom. Sorry, they should be at the resident's bedside and brought to the bathrooms. A bathroom in any room, you should keep the sink clear so that it's easy to clean. It's hard to talk about overstocking residents' rooms because it's their treasures, the things they hold dear. But really asking family not to bring in a whole lot of stuff is probably a continual battle. And if there is something, for instance, like a certain kind of, depends or something where the family wants to bring that in and have the resident use that, try to store stuff like that in a separate storage space than in the room so that the room isn't getting too cluttered up. I'm sure that storage and space in all our facilities is a conundrum. Next slide. So this is referring to like the spa room or the shared bathing space. If you don't already have a system for keeping personal items separate from each other, I would suggest you put that in place and try to avoid bringing all the towels in so that you have a bunch of towels left over at the end of the day. Really bring only as many as you need for that day. Next slide. Oh, storage spaces. How much we love storage and hate storage at the same time. Really here we want to ensure that you are looking at this storage space and seeing that devices that are clean are separated from things that are soiled. So you should have a designated space for clean devices or equipment, separate from the space where you bring soiled devices or equipment. If you don't have a method for identifying clean items, it's a good time now to develop that. So here in acute care, for instance, we have the green means clean, and we have that also at our amalgamated facilities. So there's a clean tag on clean items, and if in doubt, clean it again. It's not worth taking the risk that you're using a soiled item. If you have areas where you are needing to have clean and soiled items together, they need to be separated by at least a meter. Next slide. So this is a soiled utility room where we have the bedpan washer. Things that can be in here that are clean should be clean PPE, of course, for the staff, and clean bedpans. And other than that, there really shouldn't be a storage for clean items at all. Clean items should be stored in another clean storage room. Have a look at your soiled utility rooms as well for flow, and see if you can, declutter in there so that it's easy for staff to get in and out and get to the bedpan washer as needed. Next slide. I'm not going to spend too much time on PPE. You should all be very familiar with PPE. We've got multiple resources out there. It's just really important to know how to don and doff and how to clean your masks, etc. Next slide. This next slide is the PPE Audit Tool that's been developed by our long-term care group, which is absolutely excellent, and I highly recommend you seek that out if you haven't seen it before. Something that two staff members could do with each other even, and really brings up good discussion. Next slide. So what's different this year? So like I said at the beginning, any resident presenting with respiratory system symptoms is considered a possible COVID until we can rule that out. So we follow the ILI/COVID protocol for those in those cases. When flu is confirmed, then we will switch to the influenza algorithms. Next slide. If you haven't seen all of our reference tools that we have available, please do check them out. They're all available on the internet and the intranet. So for your affiliated, go to the internet, and we're trying to put up as many as of our influenza tools that we have so that you have access to them on the internet. Next slide. So we're on to declaring and confirming an outbreak. So next slide, please. So the IPAC team and the CD team will determine if your unit meets the definition for an outbreak. In Island Health, the IPAC team informs our outbreak management structure leader, and we set up a meeting. The affiliates will get guidance from the CD program, just as it always has been. Next slide. So for Island Health facilities, if you've never been through an outbreak, this is just a little snapshot of why we do this outbreak meeting. And I think the important point here is that we do include all services on that outbreak meeting. So dietary, housekeeping, logistics, etc., just to make sure that everything is in place and we can get you something at your facility in a timely fashion. So if you are short on PPE, we address that. If housekeeping is unsure about something, we address that at these daily meetings. Next slide. So the responsibilities of the IPAC team during an outbreak are, we're really reviewing the cases, declaring an outbreak, setting up the OMS, letting everybody know, reviewing the line list, identifying the source case. You know, we're doing all the work in that, looking at the bigger picture of the way transmission is happening. We can do audits, hand hygiene and environmental audits, which will maybe give us an idea of where we need to work on a little bit more. At the end, we do a summary of the outbreak and try and look for areas of improvement. Next slide. The role of the CD team is essentially, the CD team is the liaison between your facility and the medical health officer. So we're doing very similar things in CD and IPAC, you know, reviewing the cases, declaring an outbreak, identifying the index case, reviewing the line lists, ensuring that control measures are working and in place at your facility, reporting back to the medical health officer, who is the decision maker really around these outbreaks, and trying to help your site management get the resources they need. So very similar roles. Next slide. So the role at the unit level or site level is, your job is to be the eyes and ears inside that facility to let the IPAC team or the CD team know what's going on. So sick calls for staff. So affiliates, you need to report that to your CD team daily. Island Health, the report goes to the manager in occupational health and safety. You want to make sure that all the signage is up, that communication has been out to the families, that there's a mechanism that everybody knows how to report a new onset of a case to the CD or IPAC team. You want to support education on site, and the other big one is to start the Tamiflu or prophylactic treatment for your residents. So next slide. So the start of prophylactic Tamiflu or Tamiflu treatment, it will be directed by the IPAC and CD teams. But now is a good time to connect with your pharmacy. So especially for affiliates, you want to connect with your community pharmacy who covers you and just say, hey, you know, we haven't forgot that flu season is around the corner. We may have a flu outbreak, want to check in with you about Tamiflu stocks, and if you know you're ready to go when we call you. The other good thing this time is to check your creatinines on all of the residents who may need a creatinine clearance done for Tamiflu treatment or prophylaxis. Now is a good time to get that all in place. Next slide. That's us. All right, next slide. The role of the frontline healthcare worker. This is where you can help your staff to look at clutter with new eyes. Their job also is, as they're doing always right now, is observing all residents for new symptoms. In the case of an outbreak, to maintain the line lists of symptomatic cases. Those are those daily reporting reports that you either fax to IPAC or CD. The other thing that you can empower your staff is to give you ideas and to look and say if there's any gaps in infection control or CD measures. Sometimes they're the best eyes and ears to know that. And as everybody is doing these days, is to know how to use their PPE properly. Next slide. So we've gotten through the worst of it, and we're going to declare the outbreak over. Next slide, please. So an outbreak will be over. It's 8 days after the last symptom onset, the last resident symptom onset. It's 8 days because it's 2 incubation periods. So we want to make sure that we have given enough time that there isn't a resident going to all of a sudden pop up with new symptoms, and then we would have to declare another outbreak. So we give it that good 8 days when it's resident onset of symptoms, and then 4 days for staff members. This time can be extended, but not shortened. So there may be reasons why we need to extend an outbreak, some mitigating factors, but we would never shorten it from that 2 incubation periods. It's really, that's a really, really important point. The other thing is, for the Island Health facilities, we do have a sort of baked in report that we do at the end of an outbreak that basically gives a summary, and I highly recommend that to the affiliates. It doesn't have to be fancy or really detailed, but it is a really good way to get something down on paper after an outbreak that you can look back and say, okay, next year we're going to really make sure we do have all those creatinine clearances, because that was a real scramble at the beginning, stuff like that. Next slide. The other really important point I want to make is outbreak cleaning has to be done before you reopen your facility. So before staff stop wearing their PPE, or you start dining in the dining room again, if that's going to be allowed, you really need to have that outbreak terminal clean done to remove all the bioburden in the facility. Next slide. Teamwork really does work, and you probably, in the time of COVID, we've never realized that more than we do now. Next slide. So I do want to lastly say that if COVID has taught us anything, it is that staff wearing masks really does help. So in light of our recent new provincial orders, really emphasize to staff that wearing your mask everywhere around the facility, when you're around your coworkers, etc., really does prevent transmission. Next slide. That's it. Thank you.
Great. Well, thank you so much, Julie, for such an informative presentation. I thought you really did that amazing justice in making it clear and easy to understand. We'll turn things over to our guest panelists just in a second here, and I'll introduce everybody. Before I do that, I'll mention quickly that we'll be doing a survey evaluation of this series, and I'll post a link to the evaluation in the Zoom chat box just in a minute here. Would really appreciate it if those of you attending today could take a minute before you leave to fill in the survey evaluation. It'll help us improve the rest of the series and know what kind of questions that you have. As a reminder, if you do have questions that you'd like to ask, you can submit those into Slido. The website is sli.do, and we're under event code #influenza season. So put questions onto there, and we'll see if we have time to get to some of them as well. So we have some great guest panelists today, and we have about 15 minutes left in our presentation for some discussion with our panelists. So I'll give them a quick introduction and then turn it over to you guys. First, we have Dr. Kibsey, who's the Medical Director of Microbiology and IPAC for Island Health. I think we have two medical health officers with us today, Dr. Hoyano and Dr. Fife. Lisa Young is here, and she's the Director of IPAC. Philip Friesen is here. He is our Interim Operations Director for Long-Term Care. And we also have Wendy Stark, who's the coordinator for the South Island Communicable Disease Program. So to start, I'd like to ask each of our panelists a question. And what I'd like to hear from each of you is what you think is one really key takeaway message from today's session about influenza. And I think Dr. Kibsey, I'll ask you to start. You should be able to unmute yourself. So Dr. Kibsey, go ahead.
Hi, I'm unmuted. My pearl to give to the group is because COVID and influenza, one COVID case makes an outbreak, but one influenza case doesn't. But I think we need to have a low threshold for testing. So oftentimes when we discover a case, with the retrospectoscope, we find out, oh, there's probably been some other types of cases who are a little more subtle presentations in the previous few days before. So I think it's extra vigilant. Make sure you check your patients twice a day, new coughs, low-grade fevers, confined to bed, not eating. Swab those folks, because that's how we're going to prevent outbreaks, is just being on top of our game. That's my pearl.
Thank you so much, Dr. Kibsey. That's a great takeaway from the session. Dr. Hoyano, how about you? What is your one key message?
I think mine would be complementary to Dr. Kibsey's, just around what we know with some of the COVID outbreaks in long-term care, and certainly with some of our influenza outbreaks in the past, is that that vigilance for staff, wellness, symptom checking is really, really important to prevent any kind of respiratory outbreak from starting in long-term care. So I think, people are probably beat over the head with this message, but just that needed daily monitoring of one's own symptoms, one's own health, and then really doing the right thing by staying home when you're ill, because one ill person can not only, obviously it's an inconvenience for you to sometimes be home, but if you affect a number of your colleagues, then that has much bigger impacts for everybody.
Thank you, Dr. Hoyano. Dr. Fife, were you able to join us today?
I did join, yes, I'm here. Yeah, so I just want to say thank you to Julie. That was a very comprehensive presentation, and my key message really is just agreeing with everything that Julie said. I think we're learning a lot about COVID right now, but we know influenza pretty well. We've been dealing with it for years, and we know how to prevent it through vaccines. We know the vaccine works. We know that using antivirals works. We know that, as Dr. Hoyano said, staying away from work if you're ill works, and we know that the use of personal protective equipment works. We just have to employ those things consistently, and at least the protective equipment is going to help us, and staying away if you're ill is going to help us with COVID as well. And I think it's particularly important that we're controlling influenza this year. It's important every year, but it's really important this year because our system is already, quite stressed with single site orders and everything. And the last thing we want to do is have a influenza outbreak that's going to put more stress on our staffing lines and cause influenza illness amongst the residents. That's going to basically weaken their capacity if they are also later on infected with COVID. And just one other key thing I would like to say on top of what Dr. Hoyano said about not coming to work if you're ill. I think as we're seeing COVID cases increasing on Vancouver Island right now, that we all have to be taking responsibility to follow our provincial health officer's recommendations and recommend our social interactions, reduce our bubbles, just so that we're really reducing the risk of bringing any of these viruses into our facilities and into our workplaces right now. So just really need to be diligent about our own personal interactions. So thank you very much, Emily. Appreciate the opportunity.
Thank you, Dr. Fife. Lisa, how about over to you? What is your key takeaways message today?
Thanks, Emily. Mine, and again, yes, thank you, Julie, for a great presentation, and all of those who've had input into that. I know there's a big team contributing to that. And mine really is around the influenza message and the documentation and reporting. I know Julie spoke about those line lists. So getting the documentation, reporting on symptoms is really key, because quite often we hear about several cases late on a Friday afternoon, and so we're left scrambling, trying to support the facility to find out what's happening, and really get all the resources in place. So it's really key to when there's a number of residents with similar symptoms, report them, make sure you've got your documents all up to date, that all the symptoms are documented in the patient's records, so that when we come in and help you with that contact tracing, that we can do it in a really thoughtful way and support you fully.
Thank you, Lisa. Philip, over to you. What is your takeaway message?
Again, thank you, Julia. I always enjoy hearing you present. Fantastic job. I'm always reminded of when you were discussing clutter and how easy it is to allow things to clutter in the hallways. Most recently, I was in part of the Summit Move, and it was amazing to watch how quickly some of the rooms became cluttered. Brand new facility, but as human beings, we like to hoard and we like to contain everything. So it was a good reminder for us to just always be fresh in terms of our perspective, in whether it's down the hallways, whether it's in resident rooms, and other areas. Always try to make things clean. Thank you.
Thank you, Philip. And Wendy, over to you. Wendy, what is your takeaway message? Oh, Wendy, I think you just need to unmute yourself.
I just figured that out. Thank you.
Awesome.
Yeah, still working on this Zoom. So yeah, no, I want to again thank Julie. It's been a while since Julie's been working with our CD program, and I'm so glad to see her now working with the IPAC team. And I think the collaboration is wonderful to have in terms of the two of us working together. And I want to encourage that for the broader long-term care group as well. So if you do have questions, please feel free to, give us a shout. We're happy to discuss whatever your concerns or issues may be, guide you in terms of direction where you can find information. I think Julie did a very good presentation today to kind of go through the fact that these documents now are not just on the intranet for the island health owned and operated facilities, but also on the internet. So all of the affiliated facilities can also look at these documents as well. And I also wanted to just bring home again the fact that while we're probably as healthcare workers very diligent around our interactions with patients, sometimes it's easy to think about our colleagues as part of our bubble, and we may be letting our guard down a little bit with that, especially when we're doing things like sharing a lunchroom or sharing common areas. So I just want to encourage people to think about those interactions that we're having with our colleagues and try to actually minimize that close interaction that we have with colleagues. Thanks.
Thank you, Wendy. So another question that I'll put out, and this can be for any of our guest panelists to answer, is what are some of the common challenges to flu outbreaks in the past that you've seen, and do you have any tips to share with our facilities?
Well, I would say it's Murray here. So and I haven't been doing the communicable disease as much lately as Dr. Hoyano has, but I think, certainly in the past, one of the challenges I noticed was just the ability to get residents started quickly on the antivirals when it's needed. So I think the key message that Julie had there was make sure that we're getting the renal function, people's weights, what dose they're going to need to go on. You've had the conversation with your pharmacy in advance so that within 12 hours, if needed, you could basically get all of the resident population on either the treatment dose or the preventive dose of Tamiflu. I think that's very important, and it's very successful at preventing the spread and severe outcomes if you can get people started on Tamiflu quickly.
One other thing I'm thinking about as Dr. Fife was talking is also about thinking about how you're going to get your lab specimens, how you're going to collect those specimens, get those swabs, and transport them to the lab, because the affiliate facilities are responsible for that lab transport now. So that's really important to think about.
The final thing I'd say is the fatigue and how staff are feeling. As Julie said, this can go on for 8 days. And that seems like small fry at the moment when we've been doing a pandemic for sort of 9-10 months. 8 days seems like nothing now. But 8 days when you're in the midst of an outbreak can feel like a really long time for staff. When we're asking them to don and doff, they're no longer putting the residents in the dining room for meals and things like that. They're having to go to every single room with meal trays and things like that. So it's a long time. So it's really being mindful of that, and they really have to be focused and thoughtful around how they're donning and doffing, their hand hygiene, and have some fun. Try and have some fun in the midst of that, just to keep everybody jolly and lighthearted. So keep your own well-being in mind.
Thank you, Lisa, and that's a really timely reminder for all of us. Another question, and this can be for any of our panelists, is when should an MHO or IPAC be called?
Well, this from sorry, I think either of us, either Lisa or myself, could answer this question, but really it's if if you're finding that the threshold is over, you know, in terms of that one case for COVID, if you've got one person with symptoms, then yes, we want to be notified right away. If it's, you know, we find out that the person is not COVID positive, but we're seeing that we have 2 or more cases that are meeting the definition for influenza-like illness, then yes, we want to be notified as well. But really at this point, because of COVID, we really need to know with one case if they're meeting that COVID definition.
And when Wendy says right away, we don't need a phone call in the middle of the night.
Good point.
Right away. Thanks, Wendy. I know we've had lots of discussions around this. You know, everybody's aware. Pop the patient on the normal droplet contact precautions. Take the swab. Do all the right things. Let us know in the morning. And this is why I said my key message at the beginning. Document all the symptoms that you've noted, so that when the morning staff come on, they can give a proper report as to what's been seen. Get the line listing sorted, and let us know first thing in the morning so that we're aware of what's happening. Otherwise, Wendy can have all the phone calls at 3 in the morning. No, I'm joking, Wendy.
Yeah. That would be the poor MHO on call.
Dr. Five's going to take himself off camera now.
Yeah, no, yeah, and I think, you know, I think if there's something concerning about a case, and by all means let us know, but I think we're getting used to, after 6 to 9 months, whatever it's been, I'm losing track of time since we've been dealing with COVID, I think all the facilities are getting used to basically taking specimens from residents with even mild symptoms, and that's fine. I don't think we need to know about every single one of those, but if you've got something that's concerning, as Wendy was saying, then by all means call. You know, if it can wait till morning, fine, but if there's something unusual, you're seeing a cluster of illness, for example, which is concerning you, then call anytime. But for the things that we're getting very used to handling now, the straightforward case of a person that, you know, maybe has a slight fever, and it might be a urinary tract infection, or maybe it's respiratory, well then, you know, do the swab, get the urinary sample as well, and do what you need to do. And the results are coming back very quickly now. I think Dr. Kibsey and the whole microbiology lab is doing an outstanding job of getting a turnaround very fast, so we can identify if there's something that we have to respond to or not.
Thank you so much, Dr. Fife. Thank you to all of our guest panelists, and especially to you, Julie, for stepping up and being our first presenter in this series. We're at time now, so unfortunately we can't take any more questions. I want to remind everyone that there's a link to our survey in the chat box. Please take a minute to fill it out. I promise it's very short, and it will really help us with the series. Next week, join us, same time, same place. We'll be talking about preparedness and containment. And just as a final thought, remind everybody, thank you all for all of your hard work. We really know that the basics work, and let's just keep doing them. And we'll see you all next week. Thank you.
Thank you.